Hey guys, Amy Woods here, owner of Saluna for Women. Do me a favor and subscribe to this channel. We are here talking about perimenopause and menopause and feminine dryness and feminine tissue and intimacy with your partner or spouse. Hit the subscribe button because the more of you that subscribes, the bigger this channel gets and the more people that see it. And this is such an important topic. So hit the subscribe button and thank you. Hello, my name's Amy Woods. I am the owner of Saluna for Women, and it's an all natural product for women, specifically for feminine care and immediate moisture for when you want to be with your partner. I had to come on here today because I saw something so disturbing yesterday that I wanted to really dive deep into discussing this. And I have a few notes that I might look at time to time because I want to make sure I cover everything. Um, you know, so first of all, I am not a doctor. I have no medical schooling, okay? However, I did work in the medical field for 12 years. I was in dialysis, and for 12 years in a dialysis clinic, you see a lot of things. Not to mention, you have to study 3 huge binders full to pass the test, be trained for 6 months before you can be licensed. Um, then the regular experience, and anybody who knows about dialysis clinics knows you come across a lot of different stuff. But the post I saw yesterday about feminine dryness um, just blew my mind. So I wanted to come on here and talk about this because and tell you a little bit about my history to show you I have a little bit of understanding of the body, of medicine, and how our systems work together. If you're dealing with the symptoms of perimenopause, first and foremost, please speak to your doctor before you try to do self um, cures, self care, and take stuff or use things that have not been proven to work, okay? And you don't know if they've been proven to work because you're not studying this. And this is why this topic needs to continue to be talked about. Um, so if you're in the throes of perimenopause or going, postmenopausal and you're having issues, please go to your doctor and discuss it. And if they are of the old school mind that HRT, hormone replacement therapy, is not safe, you need to find a new doctor. HRT helps with so many different things. And it's, the study that doctors are going off of was, first of all, not completed. Some of the clinical studies were done on men. Okay. Think about that for a minute. If you're giving the dosage of hormone replacement therapy to a man who does not need those levels of hormones, of course there's going to be issues. Of course there's going to be cancer. Of course they're going to develop problems because that's not how their body is designed. Our body is designed for those levels of hormones. We are such two different creatures in physiology that when they studied that, it made no sense. And I don't know if that was the one in the early 2000s or if there was one before that was done on men. But even the one in the early 2000s was not completed, okay? Um, and, our mother's mother were not taught about this. They were taught, and any experimental drug that they received for their hormones did cause cancer because they didn't know enough. The fact that doctors today are only given one seminar for 30 minutes to an hour on this topic shows doctors are not being forced to study a woman's body in relation to how it functions with hormones. Um, and the fact that our mothers were put through, for lack of better words, hell, um, with all these experiments and doctors not really knowing and saying they had hysteria and committed to mental institutions. And, this is when the most divorces happened back when divorces weren't happening. Um, that was taught to our mothers. And my mom was not one who took HRT, and she had a hysterectomy at the age of 35. So when, you know, the generational thing happened with her mother and it went to my mom, their answer for these issues were to have hysterectomies, which threw you into immediate menopause, and they were just left with no relief. They were left with no medicine. They were left with no replacing those much needed hormones. And consequently, my mom had gotten sick with RSV and she was coughing and she broke two vertebrae from coughing because that's how brittle her bones became. And on top of it, she ended up with breast cancer. Now, the old studies says HRT causes breast cancer, but the fact of the matter is the lack of HRT can actually cause breast cancer. Now, my own history is because of my family history with breast cancer, I started getting mammograms at a very early age. I actually go for mammograms and MRIs every 6 months, which up until a year ago was necessary. My tissue was extremely dense, so if anything did come up, it would be very hard to spot. Since being placed on hormone replacement therapy, my density has disappeared. So now, if anything comes up, I can catch it immediately. Okay, so the fact that HRT causes breast cancer is not true. What causes it and causes women's cancer to be fatal is the fact that their tissue is so dense they can't spot it in time. And once it's visible, it ends up being at stage 4 and it's very hard to come back from. Or it's metastasized. I can't say that word. It's metastasized because they couldn't catch it. Um, so my mom, I'm 48 right now. So my mom's in her 70s. Even her generation was told, this is not good for you. You don't need to take it. Your family history. My product line has to do with feminine dryness, the tissue repair, the atrophy, the pelvic floor, and repairing that and helping women regain their intimacy confidence, okay? Because when you're going through this and you have no libido whatsoever, and everything in that area is like a desert, the furthest thing from your mind is being intimate with your partner. You're trying to avoid it. And going back to the post that I saw yesterday, this poor lady must not have had a good doctor. And I really hope she went to the ER. What she did is she took a tampon and she soaked it in castor oil and then she inserted it. And after leaving it sit there, now she's getting blood clots, she's getting severe cramping, etc., etc. And the bad part is on these comments, I heard people say, well, it's safe to use internally. Our grandparents used it for constipation. I'm like, what? What are you talking about? This is not a safe product to insert for feminine dryness. Okay. First of all, not many people use castor oil anymore for constipation. That's number one. Number two, the tissue is completely different. And when I say I really, really hope she went to the ER, it sounded to me like she was starting to go into toxic shock syndrome. So, which can be deadly. And, it causes cramping. And you have so many more different types of blood vessels in that area. So your tissue's thinner for the shedding of your endometrium. Your tissue is, you know, porous for becoming pregnant. Your tissue is completely designed differently than what your stomach tissue and your bowels are. So when somebody tells me they did a castor oil pack for feminine dryness, I'm thinking, where is her doctor? Where is the training for her doctor? What is going on here that she felt so desperate as to use castor oil for feminine dryness? Okay. Now, a lot of people say, oh, it's all natural. It's okay to use, it's okay to take. This is an all natural product. If it's not been tested for human consumption in different ways, you should not be using it. Okay. And I caution a lot of my friends, even because I get thrown at me all the time when I'm talking about this. Oh, you should take this. You should take that. I also have regular medications for, my medical issues that do not combine with certain things. And not everybody's body should consume something just because it's all natural. Okay? Because that'd be me like saying, oh, I should go outside and eat whatever's growing. Okay? Just because it's all natural does not make it safe for human consumption. So please, I beg you, please, please, please talk to your doctor first. Talk about HRT. And if that doctor is still of the old school mindset, you need to go to menopausesociety.org and find somebody who is registered with them, who has studied menopause and perimenopause and understands what the new study has shown. And the new study has shown it prevents heart problems, it prevents breast cancer, it prevents bone loss, it promotes muscular skeletal, um, you know, cohesion and gets rid of those aches and pains. It brings back your energy. It helps you absorb the nutrients you need. Because when you're going through perimenopause, the drop in hormones affects every single part of your body as a woman. So it is so important to talk to your doctor or find one who is up to date with the new studies. And even in my doctor's office, I finally, after 8 years of going through this, found an amazing doctor who sadly is retiring in 2 years, who has helped me tremendously. We figured out that I was iron deficient, that I needed an ablation, and we figured out all my issues were hormone related. And I can, email her now and be like, look, all these symptoms are coming back. Can we increase my estroidal? And she does it without even having to see me because we have such good communication about this topic. Now, the surgeon who is also a part of that office who did my ablation, wonderful surgeon, but he didn't have the same training. And when I asked him, how will I know I go into menopause? Because an endometrial ablation stops your periods and stops the monthly bleed. He said, you won't. And I go, what do you mean I won't? Can't they test my hormones like my FSH or FHS? The follicle stim FSH. I had to say the word to get it out. But I was like, they can test that, can't they? And he goes, well, I suppose, but that's not going to determine that. I'm like, that's how they determine. So the difference in training between somebody who has specifically devoted their time to menopause and perimenopause, and a gynecologist and a gynecological surgeon on top of it who has not had any training in it is massive. The difference in knowledge is massive. Um, so what can we do about this? How do we know what products to use? Because I also don't believe there's a lot of wonderful products out there, but a lot of them have parabens, which, our skin is sensitive to at this time frame. I have eczema, so I can't use anything with parabens. Um, there's silicone, there's plastic, there's all sort, the um petroleum, okay? Petroleum jelly is okay, but it's not safe for long-term use. It's not safe to always use. So I got to thinking about this because I'm going through that stage of feminine dryness, and my mind and my body are not matching up. I really love having fun with my husband. However, the products that are out there today kept irritating me, kept giving me sores, kept, I felt I would bleed afterwards. I would bleed afterwards and have tears in the tissue, and it wasn't fun for me. And it got to the point where I'm like, just don't touch me. And that had to be fixed, okay? Because we enjoy being together. So I'm like, what can I do about this? What can I do? So I started researching things that have been medically researched on natural ingredients that are safe for feminine use. And I created a dual product, and I'm patent pending with this formula. It's got sea buckhorn. It's got hyaluronic acid. It has lactic and citric acid to promote pH balance that you need down there. It has vitamin E. It has aloe. It has jojoba oil. Um, and there's a few other things in there. But these are all clinically tested to be able to be used for feminine dryness. And it can be used for intimate lubrication. So not only do you have an immediate use of intimate lubrication when you want to be with your person, instead of using all the stuff out there that irritates your skin, you can use this, and it not only works for that, but it can work to help heal the tissues down there. It helps promote, it helps bring back the juiciness of your feminine parts. So I really highly recommend you get in now. We are in pre-sales, um, and we're hoping for our first shipment to be sent out January 15th through the 30th. Um, we're in the middle of manufacturing, getting everything FDA approved, getting it tested, everything. But right now you can get it for $27, okay? And on top of it, you're part of the founding member circle, which means you get 20% off any Saluna for Women products that are made in the future for life. You get first dibs on any products that come into play. You also receive an affiliate link. So if you want to earn a little money and help promote this, you get a 40% commission. But once these pre-sales, I have a certain number of, let me look here. Okay, so after 800 of these are sold, which they are selling and they're selling fast, we are increasing to the regular retail price of $45, and there's no longer the founding members. So get in now. Do this now while there's still a chance to benefit from it in more than just the product way. But I had to come on here and talk about this because please, please, please consult your physician before you do anything that is not specifically for feminine use. Okay. Constipation is totally different than feminine dryness, and that should be very noted. Um, Different parts of your body have different tissues. You wouldn't put the castor oil in your brain to get rid of a headache because you feel like your sinuses are dry. Don't use things that are not supposed to be used, okay? Go to the link below and get in on this founding members circle. Get your Saluna for Women today, okay? Um, Again, you will also receive updates on production and when shipment is going out. So I'm really excited about this. We need to start talking more about this to educate people because obviously it's still not enough of what's being done. So I will talk to you soon. Are you an expert in perimenopause and menopause? If so, I want you on my show. Let's coordinate together. Go ahead, send me a message or comment below this video, and I will reach back out to you. Let's connect together and bring more awareness together around this topic. It is such an important topic that needs even more people talking about it. So please comment below if you would like to be a guest, and we will coordinate our schedule and get that set up. And I'll talk to you soon.